Good morning, everyone. It's wonderful to see lots of well-known faces, as well as new faces that I don't know. That's I think very healthy for our community. Delighted to host all of you with the help of HDR UK. We're going to have a very busy day, but I'm pretty sure you're going to be learning and a lot of things and meeting a lot of interesting people and hearing a lot of interesting stuff. Before we start with the scientific content for the meeting, I'm going to invite Rose Walker, who has agreed to join us and do the welcoming. Rose is the Director of Strategy at HDR UK, and I'm really grateful that she could make it today to welcome all of us to this building. Thank you, Rose.
Great. Thanks, Danny. And it's lovely to be here. And for those of you that saw the earlier versions of the agenda, I'm not Andrew Morris, but he managed to not be in the right part of the country at the right time. So I will do my best to welcome you all and give a warm welcome. Alex has asked me to do the housekeeping first. So bear with me, but I haven't got it 100% right. But hopefully you've got in your pack all the details you need. We don't have a fire alarm planned, so if you do hear something, please do follow everybody to the nearest exit. And please do let us know if you need any other facilities while you're here today. The bathrooms are on this floor. You'll find them on the left-hand side as you walk back towards the catering area. And here's a QR code. Take it if you need the details. I will leave there. Alex, have I forgotten anything? Yes, so be grateful you've made it onto the list. So Alex has a long list of waiting colleagues who wanted to be here today, but unfortunately, even with this big space, it wasn't quite sufficient. So yes, do cozy up. So I'm just going to say a huge welcome, but also just give you a little bit of an oversight of why HDR UK thinks that the work of OHDSI and all of the great work that you are all responsible for is so important. So for those of you where HDR UK is a little bit newer, I'm sure many of you have heard about us already. We were set up in 2018 as the National Institute for Health Data Science, and our mission is to accelerate trustworthy data use and enable discoveries that improve people's lives. And really the long-term vision, and we were very fortunate that the 9 core funders that established us back then really did have that long-term vision to accelerate a whole breadth of health research, all the way from biomedical discovery, all the way through trials, public health, and into routine health systems, but really putting data at the heart of that. And on this curve, I think what's will undoubtedly resonate with you all today is that quite often all the limelight goes to the last 3 bubbles. So you get your new insight, you save lives, you're putting things into practice, that's fantastic. But actually, there's a huge amount of important work needed to actually allow researchers and innovators to find the data, to get access to it, and importantly, to link and curate it so that you really do get that value from large-scale data sets as rapidly as possible and don't go through all the heavy lifting over and over again. And from a UK perspective, HDR UK, had an ambition when we first set out. This was a graph that I actually drew on a piece of paper for Andrew in about the second week of joining HDR UK. And we could see that, at a UK-wide scale, the UK really does have a great opportunity to bring things together across the whole population, so every single individual in the country, but also from the cradle to grave perspective and increasingly with diversity and detail in all its forms. And actually, when we set out, I don't think we were that ambitious to think that we would be able to do a study on 67 million people, but with the thanks of Kathy Sadler, Aziz Sheikh and Angela Wood, that has now actually happened. The Coalesce study, for those that don't know it, looking at vaccine uptake in the pandemic has actually been done across all 4 nations. Huge amount of work to do to make that more routine and make it easier, but it is possible, and we want to continue pushing towards that vision of making that sort of research more routine. But really, this isn't about the WYSI studies. Exemplars are important, but it's about building the ecosystem, and it's about infrastructure. And at HDR UK, when we say infrastructure, we don't just mean the tech, we mean the information governance, we mean the public engagement and involvement, we mean the standards, which is why we're all here today. And it means, really moving away culturally from this one-to-one relationship between data sets and users into a many-to-many approach. And really, again, this is an old slide, but I wanted to pick out an article that I read recently from a member of HDRK's International Advisory Board. And if you haven't read it, there's a link at the bottom there. I would recommend it. So Gavin Starks was the CEO of the Open Data Institute when it was established many years ago. He actually spends his time looking at climate data now. But all of these quotes really resonated with me. It's great that the world of data is now in the spotlight. It's great that innovations from AI and all of those uses are really delivering value. But actually, we still haven't quite got it right in terms of how we think of data and how we get an ecosystem to work together to really, make the kind of value from this data be a kind of an accelerant across many different forms rather than being kind of point-by-point solutions. And the last bit, quite often we talk about the boring bits. I just wish I could get rid of that word because they're clearly not the boring bits because we all find them really interesting. But if we could find the way to crack some of those bottlenecks, I think we will go a very long way, which is why I'm so excited about many of you being here today, helping us with that to make these data accessible to as many people as possible. So a little bit about HDRK's model itself, noting all of that kind of ambition. So we have a triple aim, and really at the heart of that is the acceleration of trustworthy data use. We want to help build and establish the infrastructure, but we have what we call a cleaning the pipes model. So let's not boil the ocean, let's not try to clean everything at once, but let's use it in anger while we're doing it so we know we're building the right infrastructure for the right reasons and we get that benefit. And we show the art of the possibles and also leave a legacy for others so that the wheel accelerates as we go. And the shape the future bit is then about noting that this is a team sport. It's not something that we believe a single organization can do by itself. I'm going to skip through in just time. Openness is really key, both from the standards, the analysis, the data access and the IG. Obviously, all of you will be familiar with FAIR and that approach and team science. And maybe last but not least to say, patients and public are at the heart of everything we do, and that's really vital, as well as looking at things through international perspective. Really great, I'll come to these slides from Alex in a moment, that we've got international colleagues in the room with us today. I think that's really important, both from a point of view of we've got a lot to learn together. We know that many countries are trying to tackle the same problems, but also to allow scale, to also allow research that can't happen in just one country but needs to cross borders. And then last but very much not least, is just to show how much of all of this aligns with OHDSI's values and approach as well. So, we are, really, really grateful and thankful for all the work of Danny, the team, and all of the collaborators that join us to push forward a community effort around how we use data to really push forward research and health benefit. And this is just about today. So all credit to the team that's put it together. I can't take any credit whatsoever. But yeah, really, really exciting day. Great to see so many people. Like I say, great to see the breadth of attendees. And I'm hoping you all have a wonderful time and happy to take any questions in the breaks, but we should probably press on in the interest of time. Great. So I think, yeah. Alex, back over to you, and we might introduce the next guest. Sorry, Alex.
Right. Oh, yeah. Yeah, I just wanted to say a big thank you to our sponsors, InterSystems, for their support for this event. Please go and look at their stand, which is just over there. Yeah, we're very grateful for their support. This is one of my colleagues has begged me to put up this QR code. They weren't able to come today. This is a survey they're running on training materials for the curation of sensitive data. So please scan the QR code and have a look at the survey if that's relevant to what you do. Just to say on the agenda, so we've got some talks. We've got a very interesting talk coming up from Jen from the Health Data Research Service. We've got a round of lightning talks this morning. Most important things are the coffee breaks, because it's not just the coffee, it's the posters, it's the software demos and the networking. So please make the most of those opportunities. So, and we have another program of interesting talks this afternoon. 2 sessions of lightning talks, 2 sessions of software demos. Also remind people, check in the program whether your poster is in the morning or the afternoon, and please, the morning people, take your poster down at lunchtime so the afternoon people can put their poster up. So then Danny and I are just going to give a quick update on what's happening in the OMOP space in the UK and Europe. And I just wanted to explain a little bit of background as we're at this event. So OHDSI UK is convened by Danny and Ed, co-led, and we're very happy as members to help out by supporting this event. And we also work together on HERON-UK, which is separate from OHDSI UK and run by many of the same people. And you'll hear lots of presentations about HERON-UK later on. But it's a real-world evidence data network based on the use of OMOP. We're very grateful to have these partners on board. And the first round of studies, there's 3 lightning talks, there's a software demo, and 3 posters here today that talk about the work of that network. So I won't say much more about it, except to say that we're now in the 2nd year. We're planning a study on cardiovascular disease. And so basically watch this space. And just to mention, many of you, I'm sure, have been to our OMOP Special Interest Group online meetings. If you want to know more, just look on our website. We're running a cancer OMOP symposium on the 18th of November, which will be of interest to many of you, so please come along. That's going to be an extended meeting. OHDSI UK has a new website, which I encourage you to look at, and there's a QR code there. I also wanted to mention that HDR UK funded 5 Eden projects. So for Eden data partners to join the Eden network and get their data on the Eden portal, and those projects are all now finished. And I also wanted to mention the work we've done with Public Health Scotland, and there's a poster on that work as well. Again, mapping data to OMOP for cohort discovery. And my colleagues in the training team at HDR UK have worked with Danny and colleagues to create a new training course, which is going to be on our training site, Futures, shortly. And again, I encourage you to have a look at that in the next week or 2, I believe. Danny.
All right, thank you, Alex. Very excited for today. I'm going to give you only a very brief and quick overview because I want to be on time for Jen, whose talk is much more important than mine. Just to tell you some new things that have happened in the last year, or give you an update on things. Eden, very well-known project, hopefully for all of you, IMI funded, finished and closed in October 2024. Eden has now moved into a sustainability phase, which is the Eden Foundation, a non-for-profit organization that shares the same values, the same mission, and the same vision as Eden, and is now divided into these 2 big strands of activity. On the right-hand side, you can see the research. So we will continue to do research in the form of studies, in the form of research programs, and in the form of methods research, but we hope to also raise funds to continue to support the Eden community, to support the maintenance of vocabularies, which we're going to hear about a lot today for the whole of Europe, not only the UK, and to support the data network and the certification in Europe. I'm not going to spend too much on this, but we have 11 FPA companies that have joined as industry advisory board members in the Eden Foundation, and we have already got 105 data partners from all over Europe who have signed a memorandum of understanding to collaborate with us, and 61, I heard today, 61 of them have signed a framework agreement, so we can subcontract them to do studies very quickly. Eden Foundation has also joined a first IHI collaboration. Just to give you an update also on Darwin EU, Darwin EU is the real-world evidence initiative for the European Medicines Agency, which uses OMOP to generate insights into problems that the regulator, the European Medicines Agency, needs to resolve or needs an answer for. It's again organized in a federated structure where we have a coordination center led from Erasmus Medical Center, where Oxford is one of the subcontractors. And we collaborate with different data partners in a federated way and with the EMA committees who ask questions to us, as you can see there. Again, data stays local, privacy by design, use of the OMOP Common Data Model to do all the analytics. And just to show you the growth of this for the last 3 years, because we are now on the 4th year of Darwin EU, we have gone from around 26 million active patients and 10 data partners to this current phase where we are at 181 million people and 16 European countries and 39 data sources, 30 data partners, and we still have another 10 that we are onboarding right now. We'll hopefully end with 40 data partners by the end of this year. I will not go into the detail of the studies that we're doing in Darwin because we don't have time for that. We probably need like 3 days. But just to say, this year we will probably complete around 70 to 80 studies on this year alone. And then finally, a new innovative health initiative project that I'm leading myself, the IHI GREC project about testing, improving, and co-creating guidance and tools for real-world evidence generation, specifically for regulatory and HTA decision-making in Europe, where we will aim to generate pilot tests and disseminate evidence-based guidance and tools for the use of real-world evidence to inform the development and evaluation of medicines and medical devices in the continent. 5-year project, co-led by myself and Annika, who is sitting in the second row here. 15 public partners, 14 industry partners, and a total budget of 26 million. 9 work packages with a lot of focus, as you can see, on regulatory decision-making, HTA decision-making, and then data is work package 6, where we will engage with the Eden Foundation to keep all those 105 data partners active. I don't have time to spend too much on this, but just to say, this is our website, so please visit the GREC website, and if you're interested or have any questions, come to Annika or myself during the coffee break. Thank you.